Welcome to HealthTech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Gaurai Uddanwadiker, an accomplished healthcare leader with over 2 decades of experience in clinical operations, quality, and business growth, currently serving as Senior Vice President of Operations at Daybreak Health. Gaurai's journey includes transforming behavioral health, driving operational excellence at scale, and mentoring the next generation of healthcare professionals. Her passion for quality care and strategic insight continues to shape healthcare delivery across the United States. Welcome to HealthTech Heroes.
Thank you, Fasa, for inviting me.
It's my pleasure. Can you tell us about a defining moment early in your career or career that inspired you to pursue the path you are on today?
When I look at my career, while it's deeply rewarding, I also recognize that it's a very non-linear path. I started out as a therapist in a hospital in Bangalore, India, but really quickly realized that I wanted more autonomy and impact, which is potentially not possible in a very large bureaucratic setup like a large hospital. One defining moment was when I was working as a therapist in that hospital, and I realized that I was more drawn to fixing systems than just fixing symptoms. I was a therapist there, so the focus was on clinical symptoms and sort of helping the patient manage those. But I realized I was more drawn to sort of fixing things that were beyond sort of zooming out from just the patient and looking at the entire system as a whole. That's when I decided to start my own behavioral health company, albeit pretty small in the beginning. And for the last 14 years, I wore both hats. I was a therapist and I was also an operator founder. What it taught me early on is that access and clinical quality are not just clinical challenges. They are also operational challenges. And I think that insight has sort of shaped my journey pretty much every step of the way.
Let me step back a little bit on this, Gaurai. Why did you become therapist in the first place? What drove you to become a therapist?
I grew up with physician parents. Both of them, like every Indian parent, wanted me to go down the path of becoming a doctor. I wasn't sure what was for me. And I sort of went into the occupational therapy school where psychiatry postings as well as psychiatry was part of the curriculum. And then when I did my master's in Bombay, again, I was very drawn to psychiatry. When I started working at this hospital, my first posting was in the Department of Psychiatry. And one of the things that the HOD, as it's called back then, head of the department, sort of pushed me, saying that you're really good at this and this is what you should be pursuing. So I also enrolled into a master's in psychology, and it started from there.
Operational has to do with a lot of dealing with people and really understanding where they're coming from and all this background. Yeah. What have been your values and experiences that have most shaped the leader you have become in healthcare?
But I want to call out one, which is around having humility in the service of learning and growing. And I call this out specifically because when I moved to the US after having done close to, sort of 14 years as a founder in India and sort of operator and CEO of that clinic, I went from being that to an entry-level coordinator at 98.6. A fantastic primary care, virtual primary care startup. But it was also a very humbling time because of the sudden change in what I was doing and what I was now doing. That experience taught me to embrace discomfort, sort of learn fast, and lead from the middle, meaning not just influencing at my level, influencing below me, but how do I influence up as well? How do I pursue it? How do I negotiate? I also learned that you can either scale systems, which is what my job was, or you can scale yourself. But you can't do both at the same time. So the way I have done this is I have become someone who thrives in building systems, which then eventually help me to grow, but also fire me. Means that I have built well, that I have done the job well. The idea is to continue to work on scaling systems, which automatically then scales me. I don't need to specifically work on scaling myself. It also fires me and makes my new challenge and new growth opportunity.
I can see that it's like one of those things that you have made the whole system super self-sustainable, that it becomes...
I'm not needed here anymore.
Yeah,
right?
Go for bigger things from there.
Yeah. It's also about sort of raising the people who are on your team. I don't need to be the boss all the time. I think, raise them up to a level and then sort of move out of their way. And they can do a far better job than you can.
Leading from the middle is a really good concept that you brought up, and I appreciate that especially because you have been a founder and then you went into almost an entry-level job. And being a leader inherently, that kind of put you in a place where you could lead from the middle. Was there any particular setback or challenge or personal or professional that changed the approach? And can you share how you worked through it? You alluded to it. How do you work through it when you do face this challenge?
When you start a new company, especially in a very bureaucratic environment like India, it is hard. It is hard to scale that up. So there were many challenges there. But why don't I focus on giving you an example from the US healthcare system? One of the ones that stands out for me was that we were trying to launch 24/7 on demand nationwide services at 98.6 primary care services. And we hit a wall with Hawaii coverage. We wanted to launch in all states. Hawaii was becoming a big bottleneck for us. We were unable to, it was a major risk. We didn't have physicians in the right time zones. And now, technically, we could have launched by asking cross licensed physicians who were living in the continental US to take on those overnight shifts. But I knew it would collapse because that is really a single point of failure. So, one of the things that we proposed, and I can't take credit for this, but this is a joint effort between multiple people on the operations team. We proposed flying physicians, continental physicians who were cross licensed in Hawaii, sort of flying them out to Hawaii temporarily instead of forcing mainland docs to do overnight shifts, which absolutely would have led to burnout, which absolutely would have led to sort of the clinic shutting down during those hours. And that decision, even though controversial at the time, saved the launch and taught me that sustainable scale, when you're scaling systems, but sustainable scaling isn't just about looking at the numbers. It's also about protecting the people behind the system. I could have absolutely gone with a lower cost option, significantly lower cost option, but then we may never have been able to launch. And that would have meant that we were not fulfilling our promises to the customers that we had signed very large contracts with. It was, for me, it was also about ensuring that A, do not have a single point of failure, and B, that we are also protecting the physicians and the people behind the system who are really the ones who are delivering care.
And what it means for the mainland is they are working late evenings or nights,
Right,
and
totally.
basically taking their time away from the family. And that was great initial expenditure of moving the physicians and having them settle down in a new continent, pretty much, right? It's like so far
And
away.
it was a win-win situation. They were going with their spouses. They were there for a quarter at a time, and then we would sort of rotate them. They would come back, and someone else would go. They were doing an evening shift, so their entire day was, I can't say free. They obviously had household duties, but their entire day was sort of filled with.
That became a benefit rather than a burden. All right.
Yeah.
Just focusing a little bit on Daybreak Health, where you are currently are. What excites you most about the mission and work at Daybreak Health, and what sets your approach apart in the evolving behavioral health landscape?
Daybreak's mission is very compelling to me personally. It's deeply to ensure that every young person can access and benefit from mental health support. I think what really sets us apart is our clinical precision combined with operational scale. We are not just matching the kids who come to us for care with the right therapists, but we are designing care models that work in multiple settings. In school systems, they are fundable through health plans, and they are scalable through technology solutions. Our care model is such that it doesn't need to bend to customer demands. Those are already incorporated in those. And we have built a clinical program that is rooted in outcomes and not so much in customizations. And for me, it is very compelling. It's also a differentiator, I believe, in the behavioral health landscape.
And what exactly Daybreak does for the audience who are not inherently
Break provides virtual therapy services to the K to 12 population. We contract with school districts and gain referrals through there. We also have parents sort of request services from us directly, and that is essentially our main offering. Slowly, we are in multiple states, and we are slowly expanding our services to potentially include medication management as well, so that we are able to serve a much larger population of students for a variety of different needs. Current focus is on low to medium acuity, and as medication management rollout happens over the end of this year to next year, we would be looking at serving higher acuity kids as well.
From your perspective, what is the proudest milestone or success that you have seen that you generally talk about to your family or your friends? What is that one success that you could share with us?
One of my biggest and proudest achievements here at Daybreak is that we have reduced we have managed to get unit economics into control. We have reduced our cost per session by over 50%.
Wow.
While maintaining high customer satisfaction scores as well as strong clinical outcomes. As you know, unit economics are super important for scaling companies. If you can't get your cost under control, or at least get your cost to a point where your revenue exceeds your gross margin is positive, and you have a healthier gross margin, I think it's almost impossible for that company to scale beyond a particular point. So reducing cost per session by over 50% in just the last 6 months is probably my proudest achievement. Again, it goes to the entire team. I don't think I can take full credit for this. The other is around clinical quality accountability frameworks that we have created at Daybreak. It is a data-driven approach to clinical quality, oversight of patient safety, and also clinician accountability, ensuring that we are really delivering on what we say we are delivering. So not just looking at clinical outcomes, because everyone looks at clinical outcomes, but we are also looking at, are we delivering the right things operationally as well as clinically that the clinicians should be doing. So there is a clinical quality accountability framework that we have created. Very proud of that. And the other is that we have published an impact study to show how our standard care flows that we have and how they drive measurable results in mere 6 to 8 sessions.
You reduced the unit cost by 50%. That's a dramatic reduction in cost. What was the key to it?
I think a fail fast approach. I think that is embedded in our culture. I see my CEO, my president, my entire executive leadership team, and the whole foundation is fail fast approach. Like try out new things, constantly iterate, whether it's clinician onboarding, whether it's hybrid staffing models, whether it is how do we do clinical supervision, how many back-to-back sessions do we schedule and things like that. There are multiple things around what goes towards cost per session. But I think fundamentally what is important here is the fail fast approach, that you keep on trying new things and sort of learning from it and iterating on it.
Effectively, you did not land on the solution definitely not on the first try.
Oh gosh, no.
Multiple.
No, not at all. I was very recently, during our just recently concluded board meeting, I was telling our investors and our board members exactly the same thing, that this did not happen overnight. I mean, for when we started working on some of the initiatives for I think 4 or 5 months or so, nothing was moving. Our cost was the same as it was before, maybe going a couple of dollars up, couple of dollars down per session, but not really having any significant changes. And then we continued to take hard decisions. We continued to show up consistently day in and day out and getting it done. And then slowly the needle started moving.
Did not happen overnight, but 6 months itself is a short time. You really lived the fail fast. It was like within this 6 months, there are like so many changes, really had your finger on the pulse, and anything changes and you have the feel for it. So that's a great story. And the second part where you said was the quality of the outcomes you're measuring. Did I get that right?
So we are measuring the clinical outcomes.
Outcomes.
But there are also certain clinician behaviors that need to happen for us to have good clinical outcomes. So the accountability framework, the clinical quality accountability framework, is not just looking at what is our GAD-7 or PHQ-9 score outcome. It is also looking at all the inputs that are happening and are all those. So it's not just the output-oriented framework, it's also the input-oriented framework. You're looking at everything that we as an operational team, the clinicians, the technology folks, everything that needs to be done happens so that we can get the output of the right clinical outcomes and patient satisfaction.
You have metrics for every step of the way until the outcomes. It's not that, hey, outcomes are great, so we can ignore everything else.
Yeah. Look at both the lagging and the leading indicators and make changes based off of that. Yeah.
So the next question is, with all these operational aspects of it, you have had these big wins. What kind of clinical challenges you had? Like if you can double click on that, and how did you go about solving those, or operational or scaling challenges you have had?
I think balancing scalability with human-centered design. And let me explain that with an example. We had signed a big contract with a health plan. And in order to support that particular contract, we required clinicians to use their EHR, their systems. But we also needed that info in our systems to ensure client and parent communications could be efficient and effective. We could track outcomes, et cetera, et cetera. We could track clinician utilization, which we wouldn't have had access to in that health plan's EHR. But this meant that there was duplicative work for the clinicians because they had to now chart in one system and they had to chart a few other things in our system as well. That is never a fantastic experience for anyone. And hence hiring for this particular role was a big, big bottleneck. we ran multiple staffing experiments, again, using that fail fast. We did a W2 full time, we did a 1099 hybrid role where they were partly seeing patients for this health plan, partly seeing patients on the other side of the house where we were getting referrals from school, and also did part-time W2 role with benefits until we sort of found a model that allowed us to flex capacity without overburdening our clinicians or blowing up the costs. Wasn't perfect, especially in the beginning, but we learned fast. We measured the impact, and whatever was undesirable, we adjusted quickly. And to me, that is what operations really looks like when done right. You will never land, especially in innovative spaces where things haven't been done like this before. You have to iterate and you have to be okay with learning as you go versus wanting the perfect solution at first.
That's awesome. And what are the challenges you're facing currently and still in iterative model?
I wouldn't say it's a challenge per se, but clinician retention is something that's always on my mind. Ultimately, they are the ones who are delivering care. It all stops with them. If we cannot retain them longer, again, you can't scale, right? But then there are so many innovative, very good behavioral health companies across the US. So what is it about Daybreak that we should be doing in order to make our clinicians stay with us? And that's something that I continue thinking about. As a clinician myself, I know one of the things that I wanted was to be treated fairly, to be compensated fairly, to reduce my administrative burden. So should we be bringing in AI scribes? Is there documentation that can be done faster? Can we provide summaries of the previous session to the therapist right away? Could there be sort of on-the-go auditing of the charts where things are surfaced up to the clinician in the session itself so that they can make improvements? Can we reduce the admin burden? And lastly, which I think is very hard to do in a startup, is create a community that the clinicians feel part of. I have always found that to be the biggest challenge anywhere that I have worked, is creating a community of clinicians and sort of sustaining it. Startup by its very nature is chaotic. There's a lot of ambiguity and it's sort of changing. When I say fail fast, it's great for me to say it, but have the clinicians having to deal with the cognitive burden of the constant change is not easy. So then we have to look at what kind of hiring processes do we have. Are we hiring the right kind of person who has a high tolerance for ambiguity? Are they clinically great? And then what should we be doing once they are in here? What kind of support systems are we setting? What kind of communication channels are we setting? What kind of community building exercises are we doing in order to retain them? It's always on my mind. I don't have the perfect answer yet, but one lives in hope.
Yeah, perfect way to end that comment. So looks like you are hopeful. You are also an agent for change, and you are also a thought leader, and you have experience in from different angles. Considering all this, I would love to have your view how the technology is redefining behavioral and primary care, and what innovation do you think will have the most impact in the next 5 years?
I think I referenced a few of those just now, but at a higher level, I think tech is moving from being a tool that we use to sort of being a teammate, collaborator, right? Your AI, automation, predictive modeling will reshape everything from early detection to care delivery. Also from what is the right match for a particular patient. Like what are the attributes of this patient? What are the preferences of this patient? And then hence what is the right match for them in order to develop a good therapeutic relationship and impact clinical outcomes. What I think we need to be careful about is just sort of digitizing or automating inefficiencies, because that can also be done. You take a current inefficient process and introduce some kind of process automation in there, and you just digitized it. It's going faster, but it's not necessarily efficient. Sort of looking at those pieces. So at Daybreak, we are investing in clinician efficiency, tools like dashboards that replace unnecessary check-ins with, let's say, staff members, who have referred those kids to us. Can they just look at dashboards and get a sense of what they need? And if at all, then they want additional information, then maybe it can get escalated to a phone call with a clinician. I believe that tech needs to free up humans to do more human work, not so much sort of replace humans. But I'm not original in that thought. I think pretty much most thought leaders around this AI space, and I do not think of myself a thought leader in the AI space, but they are the ones who are saying that, and I completely agree with them. Especially excited about generative AI for documentation and then triage of patients, on the go chart auditing, on the go sort of chart documentation, etc. Then there is this new field, upcoming field around precision mental health using biosensors and digital phenotyping. I'm interested in it. And then there is obviously this integration of mental and physical health through shared platforms. So can we bring together multiple great things from different companies, and can there be a shared platform there? I think it's the holy grail. Someone's going to solve it, and I am excited for it.
One of the important things you said was do not automate inefficiencies. I thought was brilliant. Like, because just because we can automate and make it perfect, don't let it exist. Evaluate it before you automate it. The other thing is I really liked was partner with AI so that humans can do more human stuff. I thought that sentence was pretty spot on. One more thing was AI is not a tool anymore. They can be considered as a partner. So there was like a lot of things in there. I have to go in and like perhaps make notes on this. There are a lot of key things that you mentioned within this. And I might have to actually disagree with that. Like, I'm not a thought leader. I think you are. It was a really good summary of where the technology is going. What advice would you give healthcare entrepreneurs and leaders seeking to create meaningful change in clinical operations or mental health care?
In the last 2 decades of having worked in this field, there is more and more conversation around being data oriented. And yes, that is very important. But one advice I would give young entrepreneurs or young operators is don't chase KPIs for the sake of chasing them. Chase the learning that comes from there, because that is what leads to sustained performance. And also don't build processes around an ideal clinician, because that doesn't exist. Build for real people. Build for a clinician who lives a regular life, who has fatigue. Build for what their context is. And then I think lastly, this is something that I say to myself all the time, is if you fire yourself from your job every few years, every few quarters by building stronger systems, stronger teams, then you're doing it right. And that needs to be the focus. So chase learning and, fire yourself from the job. I think those are some of my big pieces of advice.
How do you stay motivated? And there is a strong resilience that I see in you when you're facing ongoing demands and uncertainties in this sector and in your career. You are one of the few people who was talking about like, hey, fire yourself. And there is a lot of uncertainty that follows this. So what is your key mindset, that strength that you bring, that key mindset that you have to be so resilient?
I think one is, do I have purpose in the work that I am doing? So I have to remind myself daily that what I do while I may be sitting behind the scenes, while I might be creating operational processes, it directly, ultimately ends up impacting children and families. Sort of keeping myself anchored with that. But then my team has t-shirts around this concept, because that is what I focus on quite a bit, which is around intentionally creating heat experiences and colliding perspectives. This is part of a theory called vertical development. Essentially, it is around sort of learning from challenges and bottlenecks, coming together and collecting different perspectives or colliding perspectives and then making sense out of. And I intentionally sometimes create heat experiences and colliding perspectives for myself and my teams. What that does is, that is where you start seeing innovation happen. That is where I start seeing growth happen. I also try and stay surrounded by people who challenge me, but who also care deeply. I have trouble being on teams where maybe people reporting to me or direct reports are yes people. I want pushback. I don't want people who will just listen to me because I'm their boss or I'm their manager. I need people to push back, and I create those environments where they feel empowered, where they feel that they have the courage to sort of push back on me, saying, Gaurai, I disagree with this, and let's have a rational conversation around this. And I think those are some of the things that help me stay in the game.
Terrific. An example where you achieved great results because of creating heat and allowing colliding thoughts to come together.
So with behavioral health clinicians, you have fully licensed clinicians who have not only done their masters, but have gone through a certain number of hours of supervised clinical work. And then they get licensed by the board of that state, and they can deliver. Before they achieve licensure, but after their masters, that supervision phase, they are called as either provisionally licensed clinicians or associate clinicians. We have a lot of associate clinicians in our company. They are supervised by what is called as associate supervisors. We were doing you can do individual supervision where one supervisor supervises an individual associate therapist. You could do what is called as dyadic, where one supervisor supervises two people at the same time. Or you could have group supervision, which is one supervisor with multiple associate therapists. Typically, how many those are in the group is decided by state regulations, a state board. We were doing individual supervision. And like I said, I was working on unit economics, and I was trying to figure out, is there a better way of doing this individual supervision? And there was a lot of collaboration between my finance leader, who really is very creative, between my clinical director at the time. And we were thinking through, are there different ways of doing supervision in order to cut down on some of that cost? And we, again, so there was a heat experience there where our unit economics, our cost per session, was significantly high for this particular category around supervision. I don't want to take supervision away. It's a regulatory requirement, but more importantly, we want to maintain clinical quality. We want to ensure patient safety, but we also want to do it in a sustainable and cost efficient manner. So we moved to a point where we started looking at, and again, I did not do this. We got together, my clinical director started looking at a variety of different clinical regulations across states. And these clinical regulations are varied. Georgia says one thing, California says something else. There is a cap on the ratio of how many associates a supervisor can supervise at one time, etc., etc. And this heat experience and me constantly asking questions of my team, especially my clinical leaders, every single week, by looking at what our cost per session was related to this particular category, but also looking at how supervision was going and how there were inefficiencies. And hey, so what are we doing about it? And that's when a lot of these different perspectives would come through. You would have the finance perspective. It was constantly talking about our cost per session is high because of this particular category. You have your clinical leaders who are worried that you can't do it in a manner that it will impact clinical quality and patient safety. So these are two colliding perspectives. And how do we then, sort of make sense of it and move forward? So we landed on the dyadic model, and then we landed on a group model as well to sort of reduce costs. It required change management because clinicians who were used to being supervised by a single supervisor, now we were saying 2 associates are going to go under them. So we had to talk about how not only are you learning from your own supervisor, you're also learning from your peer. There are going to be some things you may not have experienced in a particular session that you require guidance on, but the other person has, or other people in the group have. And there is more learning that comes out of it, and there is cost savings. So yeah, that's one example. And we eventually moved to a place where addict supervision seems to be where we are focused.
It looks like one of the tools to create the heat are questions. So utilize questions quite a bit. Ask questions, how can we solve this and keep the heat up? As we go through and being sensitive to your time as well, the question for you is, when you look at leaderships and entrepreneurs, what is that one non-negotiable mindset you say that they should bring to the table when you're working on something that is so complex and it has a big impact on patient lives?
We often celebrate success, and the way I define success is we hit our goals. We hit a particular metric, we hit a particular threshold, we hit a particular cost per session, right? And I think it's very important instead to focus on effectiveness. As leaders, in the beginning, hey, I have focused on success as well. I have focused on hitting my metrics and hitting my targets. But as I have grown in this industry, I think effectiveness is very, very important. And I think this applies across all industries. Effectiveness is about moving the needle sustainably through yourself and your own team, even when you are not in the room. So it's about perseverance, it's about showing up, it's about ability to negotiate, it is about influencing from the middle, it is about being comfortable with failure, and it's about focusing on learning and growth versus just hitting the target. The hitting the target will happen as an outcome of your leadership effectiveness. And I think that's what we should be building, and that's what we should be focusing on.
And before we wrap up, Gaurai, you will have 90 seconds. If you want to definitely take more time to share anything we might have missed or reiterate anything that you think is very important for our audience. And basically the question is yours, the answer is yours, and the stage is yours.
Operational excellence is not about control. It's about clarity, and it's about courage. Clarity of mission. Why am I here? What am I doing? Clarity of metrics. What do I need to drive towards? And clarity of mindness. Am I an effective leader in order to achieve, the metrics and sort of align with the mission? And the courage to experiment, courage to trust your people, and more importantly, the courage to admit when something is not working. So being very comfortable in that space. And if you're building in this space, in mental health space, you are not just scaling a business. Remember that you are scaling hope. And I think that is what I want to leave my viewers with, that you are scaling hope. So be grounded in that, be anchored in that particular mission.
Thank you very much. And I really appreciate your time.
Thank you.